Alderman Boyd,
Present.
Alderwoman Howard,
Present.
Alderwoman Hubbard,
Present.
Alderman Muhammad,
Present.
Alderwoman Boyd,
Present.
Alderwoman Clark Hubbard,
Here.
Chairman Vaccaro.
Present.
Yes, President, you have
A quorum. We have a quorum. So we need approval of the minutes from the Thursday, March 5th meeting. So I'll make a motion that we approve the minutes. I need a second.
Second.
Everybody's
Second.
unmuted.
Second.
Oh, everybody's muted. Okay, Madam Clerk, please. call the
Second.
roll.
Alderman Boyd, Alderman Boyd, Alderwoman Howard,
Aye.
Alderwoman Hubbard,
Aye.
Alderman Muhammad,
Aye.
Alderwoman Boyd,
Aye.
Alderwoman Clark Hubbard,
Aye.
Chairman Vaccaro.
Aye.
7-0.
So we're going to start with the mayor. We're going to start with Alderwoman Howard. We're going to start with the mayor's appointment to the COB. If you could present that.
Mr. Chair, Chairman Vaccaro, and esteemed colleagues, I'd like to introduce Mr. Frank Copanas. He is a constituent of mine in the 14th Ward, and he has applied for the position on the Civilian Review Board District 6. You have the resume is in your packet of information. Mr. Copanas currently owns his own home inspection agency, and he previously worked as a counselor. I think his resume is stellar, and I think he would bring a balance to the Citizens Oversight Board. And I ask for his favorable consideration. Mr. Copanas, would you like to speak to the committee?
Sure. I just want to let the committee know I would be glad to help in any way that I can. I take my residency in the city seriously, and anything I can do to help, I'd be glad to do so.
Okay. What I think, if it's okay with you, Alderwoman Howard, if it's okay with you, we'll go down the list. Alderman Boyd, Vice Chairman Boyd, any questions?
Yes, Mr. Copanas, first of all, thank you for your willingness to serve. I'm just kind of curious, what are your thoughts about policing today? How do you feel? What kind of job do you think we're doing as it relates to policing across the city? Can you hear me?
Well, I can. I know several policemen and feel like that I have good relationships with them. I haven't had a lot of personal interaction with the police department in my own life. So my experiences are basically related to what in the media or from other people. But I would like to do anything I can to help improve the relationship between the citizens of our city and the police department. and would be glad to help in any way I can with that.
Okay, thank you very much. No further questions.
Okay. Alderwoman Tamika Hubbard, questions?
Thank you, Mr. Chairman and members of the committee. Good morning, everyone. I just have a few brief questions. For some reason, I can't access my documents to get like an overview of what your background is and what your experience is. Can you tell us briefly, like what you've done, what tenure you've had, what capacity have you worked in, what community you are from or reside in, just to give us a background of somewhat of who you are.
Sure. So I live in the Southampton neighborhood. Previous to that, I lived on Louisiana, down close to Dad's Cookies, and I apologize that wards and neighborhood names not coming to mind quickly off the cuff there. I've been a home inspector for a number of years, but prior to that, I was a family therapist, working with families who had adopted. And originally, I'm from Cape Girardeau, Missouri. I've been a member of a number of PTOs and served on. I'm also a member of my professional organization for home inspectors and have served on the board and been president of the board for a number of years. And then also been involved in Boy Scouts and served in multiple officer positions in those organizations.
Okay, thank you. And so one other quick question, because
Sure.
clearly with everything that goes on in our community, sometimes with community and police relations, sometimes it can be very challenging. What compelled you to want to engage yourself in this process at this level, you know, and be unbiased and help, you know, make good decisions in regards to the interactions of police and members of the community? What prompted you? What compelled you? How did you get here before us today?
Sure. One of the major reasons that I'm here is being asked if I would be willing to take on that role.
Okay, so you said you were asked. Is it something that prior to now that you've always taken an interest in, as far as community policing or police and community engagement? Is that something that you've been intrigued by?
Well, I am, because I've spent prior to becoming a home inspector a good portion of my life trying to help people who are having difficulties, you know, relationships. So improving any relationships are important, but I feel like that the relationship sometimes between our police department and our citizens could be better than it is. And if there's anything I can do to help with that, I'd be glad to do that.
Okay. Thank you. No further questions, Mr. Chairman.
Thank you. Alderman Muhammad.
No questions, Mr. Chairman. I trust the opinion and expertise of my colleague from the 14. I look forward to Mr. Copanas' service on the board, on Civilian Oversight Board. I have no questions.
Okay, thank you. Alderwoman Pam Boyd.
Thank you, Alderman.
Pam, you're muted. Unmute your mic.
Okay, I have, the question that I have is, what made you decide to want to sit on the COB 1, and then 2, do you kind of know what the responsibilities are, or do you think that, and if you do you think that it's something that needs to be added to empower you all as a committee more?
My exposure to what the board does is basically limited to media coverage, discussions with Alderwoman Howard and another committee member, and just a review of the basic information there about how the board was created. So I must say that I feel like that's limited, but I feel like it's important for me to do whatever I can to help my city, to help my fellow citizens, to help policemen too, if I can. And I would be glad to, to learn more. I know that's part of how this works. I'd be glad to learn as much as possible, prior to participating in the board.
Okay, thank you. That's all, Mr. Chair, I
Any
have.
other questions? Okay, and then Alderwoman Shameen Clark Hubbard.
No questions, thank you.
Okay, I guess I have just only a couple. And let me ask before I even do that. Molly, are you here for this or for Board Bill 11? Can we unmute Molly for a minute there?
I am here for Board Bill
Molly,
11.
are you here for this or for Board Bill 11?
Hi,
Okay, we'll be there in just a minute.
I'm here for Board
So-
Bill 11. Okay.
Okay, we'll get to you there. Okay, so I think the question that they were asking, if you could, Mr. Copanas, is did someone approach you or did you seek to do this? And I think that's what they were asking. In other words, it's something in the police department or other than maybe Alderwoman Howard, which is absolutely fine. But I think the question they're trying to get to is, were you approached by someone, or is this something you kind of wanted to do and you talked to Alderwoman Howard about it? And I believe that's the question.
Sure. Thank you. Well, thank you for clarifying that. I apologize I wasn't following that. I have not been asked by anyone from the police department I am friends because I previously lived close to Brad Artiga. I had heard about the board from Brad and knew that there was an opening available. And that's basically how this started anyway. But then afterwards, I did talk with Alderwoman Howard.
And she's a good person to talk to. I would just say, does anyone have any other follow-up questions? Okay, hearing none, Alderwoman Howard, you're open to close on the nomination then.
Yes, I would like the committee's favorable consideration of. I would like the committee's favorable consideration of Mr. Copanas as a member of the Citizens Oversight Board, and ask for your vote to move him through the Board of Aldermen.
So it was seconded by Alderman Muhammad. Madam Clerk, please call the roll.
Alderman Boyd,
Aye.
Alderwoman Howard,
Aye.
Alderwoman Hubbard,
Aye.
Alderman Muhammad,
Aye.
Alderwoman Boyd,
Aye.
Alderwoman Clark Hubbard,
Aye.
Chairman Bucaro.
Aye.
7 aye votes.
Okay, by doing that, we pass that out of committee. Thank you, Mr. Copanas. You don't have to stay for the rest of the meeting if you don't want. Carol, thank you for bringing him to us. He seems like he's going to be a great candidate.
Thank you,
again,
Frank. I
everyone.
appreciate it. Look forward to working with you.
Thank you, Alderwoman, and thank you to everyone else on the committee. I appreciate your support.
You're welcome.
Okay.
And if you want to jump out, you can. You can stay if you like, but we don't do anything that exciting.
Well, thank you. I appreciate it. Have a good day.
To be an oversight board.
So now, Alderman Bret Narayan, you're recognized to speak on Board Bill 11.
You say what?
Thank you, Mr. Chairman and members of the committee. Does everyone have Board Bill 11 in front of them at this time?
I don't. I can try
Okay.
to find it.
I'll just give a kind of a broad overview of it for any who don't have it in front of them. This is a bill that essentially prohibits the intentional coughing, sneezing, or spitting, all of which are defined terms in the bill, on any essential worker, which for essential worker, we took the health department's definition of essential worker. And so this bill would prohibit anyone intentionally coughing, sneezing, or spitting on an essential worker while they were carrying out their essential work. It would punish anyone who did so with a fine of anywhere from $250 to $500 and or a potential term of imprisonment of not more than 90 days. There's an emergency clause in this. There's also a sundown clause in it, so that this is something that the hope is that there's not a need for indefinitely moving forward. This is very much born out of the current COVID-19 crisis. So actually, this bill sundowns on July 1st, 2021. This bill would give the city a more meaningful sanction for those who did intentionally cough, sneeze, or spit on essential workers. Right now, anyone who does that is being charged under the terroristic threat charge code. And so that is a Class D felony that I believe at least that the prosecutor has to try and kind of thread the needle on in order to meet the elements of that crime for someone who would spit on one of our essential workers. This gives a much more direct line that's easier to fulfill the elements for the prosecutor should they need to enforce this against anyone. I think it's important to note that this bill in no way differentiates someone who is positive for COVID as to someone who's negative for COVID. There's not an additional punishment should that person who is prosecuted be COVID-19 positive. This is across the board, just putting out a message to our workers that, if the state and the federal government are going to make you go back to work where I know that some of us think that it's premature, that we're going to have their backs and we're going to make sure that they have some modicum of safety in the workplace. And I think that starts with making sure that people don't cough, sneeze, or spit on them while they're simply trying to carry out their duties. And I'd be happy to take any questions from anyone at this point.
We're gonna go down the list of other people, and then Molly, you're gonna be last on the list, and then people might have questions for you. So Vice Chairman Boyd, any questions to the chairman, to the sponsor? Excuse me.
You're muted, Alderman Boyd.
Okay, sorry about that. Yeah, my question is, don't we already have laws on the books that would cover spitting on people?
So there's it would fall under a general assault at the moment. So I think where it gets more complex is for someone who would cough on someone, because the prosecutor would have to prove out the elements of assault there or a battery there, and it's much more difficult to do, I think, on a cough than on spitting. Spitting is a classic assault. This just essentially gives our prosecutors another arrow in the quiver to deal with this, because right now they're charging under, if you've heard Judge Edwards talk about it, they're charging under the terroristic threat ordinance. And I think that may actually go too far. That's a very serious felony, making terroristic threats. And B, I'm not convinced that a savvy defense attorney couldn't easily show that the action of coughing in particular or sneezing in particular on someone doesn't necessarily meet all the elements for a conviction there.
Okay, but Missouri statute, their Missouri statute that covers assaults, right? And
Yes.
I would agree with you, maybe that's a little extreme considering a terrorist threat. But I'm always concerned at coming up with, legislation when we already have something we can charge them with. Because I was looking at Missouri statute 565.056 that talks about assault in the fourth degree, which is kind of in line with what your considerations are. And one of the elements, let's see here, a person recklessly engaged in conduct which creates a substantial risk of death or serious physical injury to another person. That's number 4. Number 6, the person knowingly causes physical contact with another person, knowing the other person will regard the contact as offensive or provocative. Certainly spitting on somebody or coughing in somebody's face is disgusting. It's just as bad as urinating on somebody. But I'm concerned about creating superfluous laws, just to be more specific when we have laws that would cover us in general with that.
So I understand that certainly, and I think that what this does is it essentially gives additional options so that our prosecutors don't have to try and thread the needle on some of these elements. For example, one of the things that you just stated was a substantial risk of harm. And so that would actually, with the burden of proof being on the prosecution, it would be on the prosecutor to prove that that cough had, a substantial risk of harming a person. And that's a difficult thing to prove out. And I think that this just gives additional options in regards to it being a superfluous law that would kind of hang out on the books. I understand that concern, and in fact, that's why we inserted the sundown clause so that on July 1st, 2021, this comes off the books, so that it's not just there indefinitely. It's not something that 20 years from now we're going to have a strange backlash on, because it simply won't be in existence after we get through this this current COVID crisis.
But right now, we're dealing with COVID-19. Next year, we could be dealing with COVID-20. And so, while I respect the fact that, you know, there's a sundown clause, at the end of the day, spitting or coughing on somebody is disgusting. So we shouldn't have a need for a sunset clause, because it's just a disgusting act, period. And people should be charged with that. I think we're learning more and more as we have information about COVID-19, how it's kind of like the flu, and it brings to mind that, you know, just a general flu, you may spit or cough on somebody and end up getting the flu potentially. I mean, I'm not a doctor, but I would just think it would be the same process. But I will go back to number 6. Number 6 says the person knowingly causes physical contact with another person, knowing the other person will regard the contact as offensive. I don't think it's hard to justify as a prosecutor, and you're a lawyer, you know better than me. I just pretend to be one sometimes. But if you spit on me, I'm going to assure you that's offensive. And
Absolutely.
anybody that doesn't think that's offensive, they're just as disgusting as a person that spit on somebody. So to me, that's kind of like common sense, that particular statement right there, and I would think would be easy to prosecute. But again, I'm not a prosecutor, but that's all I have.
I think the difficulties there lean more towards the sneezing and spitting, or excuse me, the sneezing and coughing than necessarily the spitting. It would be on the prosecutor then to show that a physical contact was made, which could be difficult if someone's just coughing kind of at you.
I mean, but wouldn't the prosecutor have to, if your bill passes, wouldn't the prosecutor still have to prove that somebody was spit on? I mean, I don't get
Oh, absolutely. But the act of coughing is the prohibited activity, not the unwanted touch, which is the prohibited activity under current assault ordinances.
Okay. No further questions.
Okay, before I go to the next person, Alderwoman Pam Boyd texted me that she can't hear us. So can I ask the person running the meeting to see if there's a way to correct that? And we'll move on, but hopefully we have a way of correcting that Alderwoman Pam cannot hear us. Can you hear it? She's muted. But anyway, let me move on to Alderwoman Tamika Hubbard, and while we're trying to correct Pam Boyd's.
Excuse me. I believe I'm next in seniority.
You know,
Yes, she is. She is.
But I was showing you the list I'm working. I gotta get that corrected. I know. I was going down the list. I'm sorry. So I will correct it on this list. Alderwoman Howard, my apologies, and I will change it on the list.
No problem.
I would ask that the clerk also correct the public safety list. Alderwoman Howard?
Yes, Alderman Narayan. I guess my question is, you keep referring to the prosecutor. Who's going to enforce this? I mean, the prosecutors aren't out looking for people sneezing and coughing. So who do you expect to enforce this?
So this would be an ordinance violation. So it could be prosecuted in the municipal court. Ultimately, of course, it would be on a police officer to cite someone on this. But I think if you have someone in the local grocery store or local retail store who's spitting on someone, coughing on someone, that a call to the police would be warranted. And ultimately, this bill is about protecting our workers as they go back into the workforce, as we open things up. I think if we're going to have these folks back at work, we need to offer them protections, and we need to show that we have their back moving forward, that this is unacceptable behavior to engage in, and that the city will not tolerate that sort of behavior towards our essential workers.
I guess the other thing is how do we decide intent? I mean, I've been in places and, I've been caught with a sneeze, tried to cover,
Sure.
I mean, I cover, but at the same time, you all of a sudden you got a sneeze in you, and, how do
Sure.
you decide who's going to decide intent? I mean,
So intent is kind of a legal term of art as well. So we've defined intent in this ordinance, line 22 of the ordinance. The term intentionally as used in this ordinance means, quote, done with intent or purpose. So it would be on the prosecutor to show that the person, that this wasn't, like you're saying, a sneeze that kind of came up on you suddenly, that this was something that you got in someone's face and expressed your dissatisfaction with them by engaging in these behaviors.
I tend to agree with the Alderman Boyd. If we have a law that addresses this, I just think that, having another one is a bit of a distraction. We're going through so many things right now, so many changes,
Right.
this historic time that we're going through. I wonder, if we're calling up the devil to do something that's already in place. I think that, we've got prosecutors dealing with, still people being shot, and police dealing with, danger in the streets, and we're gonna, put this out there. I don't see the point in having this, but anyway, I agree with Alderman Boyd and citing what we already have on the book. That's all I have. Thank you.
I think the issue that
If you
we've
wanna
seen. I'm sorry. Oh,
I said you can respond. I mean, if you have a response.
Yes, ma'am. I think the issue that we're seeing with what's already on the books is that the prosecutors are having to shoehorn in these acts into this terroristic threat charge, which is not an appropriate charge necessarily. And so we've seen, I think Judge Edwards indicated that we've seen 4, potentially 5, I'm a little off on my numbers right now, 4 or 5 of these prosecutions that have had to go under this terroristic threat charge, which A, could be draconian in sentencing, and B, it's going to be hard to line up a prosecution on, because to prove out the elements there is very difficult, whereas the elements on this proposed ordinance are very simple and prohibiting exactly the type of activity that I think we should be concerned about in regards to our essential workers.
Okay.
Okay.
Alderwoman Tamika Hubbard.
Thank you, Mr. Chairman, and members of the committee. I guess I have some concerns, because I just hope that our community or our population hasn't gotten to the point where this is really an issue as far as people spitting on each other. And with all due respect, Alderman Narayan, I wish you had shown this much care and concern for some of the legitimate health issues and concerns in my community when we were working very hard to help my constituents get a hospital in North St. Louis. But I guess this is something that is important to you. I just feel that it's not that big of an issue, especially if we have stuff already on the books. I don't know how this came about. I definitely am in support of people having the protections that they need, but I wouldn't want this to have an adverse effect on the community and we give people a means or a loophole to further prosecute someone for something like this. So it will be a no vote for me. I will not be in support of this. I feel like right now time is very crucial. It's kind of unfortunate that we have to conduct our business in this process, and I feel that we should not set a precedent of, you know, just having committees with one bill in it, and especially something that I don't believe is a problem for us in our city at this time. So I will not be in support of it, and I would encourage all my colleagues not to be in support of it, because to me it appears to be redundant and a waste of time when we already have a law in the books regarding it. And that's all I have. Thank you.
Thank you. Alderman John Muhammad. You got to unmute yourself there.
Thank you, Mr. Chairman. I'm reading the bill, and to me, it seems like weak legislation. It does not make sense while creating or jury-rigging laws to punish people, specifically for spreading coronavirus. Technically, that's possible. We can do that, but turning someone who passes on a disease into a criminal does not keep a community safe. I don't see any real substance in the bill. In fact, what if I cough or sneeze on someone, but I do not have the coronavirus, and I'm not infectious? Would that still deem me as a criminal under the regulations of this particular board bill? I think there's a lot of unanswered questions about it.
It absolutely would under this.
Yeah, so I'm against that, right? So if a person coughs on me and he or she is not infectious, they would still be deemed a criminal, right? So the cougher would have to know that they're infected with this disease, to know that they are potentially and intentionally spreading coronavirus, and we don't know that yet. This is not good legislation. I think this makes our legislative body look a little silly. I'm a no vote for this, Mr. Chairman. And I have to agree with my colleague from the 5th. It's just ironic that you will support this bill saying you support healthcare, but you voted against a healthcare facility in North St. Louis. I'm just against this bill. I don't think it's good legislation. No further comments, Mr. Chairman.
Alderwoman Pam Boyd, I know you're having some problems hearing us, but do you have questions?
Can you all hear me?
Yes.
Okay, because I might look funny. I'm trying to put my phone up so I can hear. But I guess the concern I have, did you talk to any policemen before you did this bill?
I talked to several folks, including counsel for the board, in both the reasoning and the drafting of this bill, to ensure that we weren't going to be targeting any individuals or communities, that there was no differentiation on whether you were positive or negative for any illness. That we were simply looking to prohibit people from intentionally putting essential workers carrying out their duties at risk. In my opinion, we need a law on the books that's not a catch-all, like making a terrorist a threat, in order to protect our essential workers. If we're going to ask these folks to go out and do their job in the middle of a pandemic, I think it's appropriate that we have ordinances on the books to ensure that we can protect them, and that people aren't spitting on them, coughing on them, sneezing on them intentionally, while we try and shoehorn in what is wrong with that. This would distinctly and clearly lay out the prohibited activities.
But I guess the reason why I asked, had you spoken to any policemen, because they probably told you that it was already on the book. So, I mean, that's going to cover the essential workers that are out there, the city workers. So I'm in agreement with my colleagues. I can't support that because it's just like we're duplicating what's already there. And as if we don't have enough issues going on out there, I don't really think that you're looking at the realistic part of it, because you already have something there. And I did call an officer and ask, was it something on the books? And they were like, yeah, and it's an assault. So,
So,
I understand, I applaud you for what you're trying to do, but I just don't think that's a good move when we already have something there.
So I certainly agree with you that there is something there on spitting. I think on coughing and sneezing, that you run into a much higher threshold. But your point is well taken. I think that we need to be doing more, particularly on the coughing and sneezing end of things. But it seems like there is not the interest out of this committee at this moment.
Okay, thank you.
Okay. Alderwoman Shameen Clark Hubbard, any questions?
I don't have any questions. I had a couple of comments, and I definitely want to hear what Molly has to say, the public speaker. But my concern, I have a couple of concerns that echo the concerns of my colleagues on this committee. So I won't ditto those and repeat those, but I do think that coughing and sneezing are an uncontrollable act at times. And I feel like, again, what Alderwoman Howard said, how would you be able to prove the intent? And then on top of that, you would get people, which disproportionately happens to the people in most of our communities, into a system they'll get caught up and be in worse things for something that may have been just an accident, but somebody will be able to use this law and then prosecute and get them caught up again in a system that we're trying to keep people out of. So I'm sorry, Brett, I won't be in support of this bill either. I just feel like we really can't legislate morals. And something like this, again, like Alderwoman Boyd said, it was good, and we understand what you're trying to do, but we looking at the bigger picture, how people will get caught up for something that could have truly been an accident. So I will be a no also. Thank you.
I will. So we're going to move on to the public speaker, but I will say, I would encourage you to probably hold this. It doesn't seem like you have the votes. And what goes through my mind right now, we have more people being shot and murdered, way more than the coronavirus. In fact, if they were comparing this many people died today from gunshots versus this many died from coronavirus, I think this kind of bill, I will echo what Alderman Muhammad said. We sort of look silly if we're, I understand this. Like if you're going to Schnucks or somewhere and you don't have your mask on, somebody gets mad and spits on you. And I would hope some laws are enforced. But I would say as a board, our bigger thing right now is where are we at with cure violence? What's going on? Why are we having, the murder count? Molly, I'm with you now. What do you got there? It's your deal now.
Hi, good morning, and thank you so much for the time. I am about to share some public testimony, which I also shared with Clerk Kennedy, which can be distributed to each of you in writing as well. My name is Molly Pearson, and I serve as the organizer for the Missouri HIV Justice Coalition, which is a project of Empower Missouri. And at the coalition, we are working to modernize Missouri's outdated and harmful HIV-specific statutes. And we recognize that this is an extremely fraught time. We are facing a global event that is unlike anything we've ever experienced in our lifetimes. Our communities have changed, and they will never be the same. We worry for ourselves and for our loved ones, especially those who are particularly vulnerable. In the early days of COVID-19 sweeping across the United States, I myself had to drop everything and race to my hometown in Nebraska to make sure that my chronically ill 71-year-old father was stocked up on his meds and food and had the technology required to see his doctors virtually. On my 7-hour drive there, I felt a tightness in my chest each time I stopped for gas or to use the bathroom. I have never, ever in my life thought so hard about such ordinary activities. But it is one thing for me to feel nervous reaching for a gas pump, and it is quite another to be an employee at such a public place like a gas station. Essential workers are shepherding us through this unprecedented time. Grocery store clerks, social service providers, healthcare workers, and more are putting their health on the line to ensure that we can all access the things that we need to survive. At Empower Missouri, we work tirelessly so that all workers receive a living wage, affordable housing, food security, and access to healthcare. We also advocate for childcare so that those who must continue to physically report to work during this time may do so with peace of mind that their kids will be safe. We recognize that we all have a part to play in our community response to COVID-19. Following CDC guidelines, practicing physical distancing, and appropriately using personal protective equipment are key steps that we can take to do our part. And at Empower Missouri, we're very fortunate to be able to do our work remotely. Although the state legislature is in its final session this week, we are advocating digitally rather than in person in order to ensure the health and safety of our staff, legislators, state employees, and advocates. The novel coronavirus is different from HIV in many ways. There is still much unknown about COVID-19, and we are learning as a society and as a globe how to contain it. What we do know is that punitive measures fail as a public health intervention. We have witnessed this firsthand here in Missouri with the criminalization of HIV over the last 30 years. At the Missouri HIV Justice Coalition, we believe the following points are essential to consider, and they can prevent us from adopting a city ordinance that would result in over-policing before it would result in mitigation of virus transmission. Intent is exceptionally difficult to prove. What would qualify as expressing intent? Something in writing, a thread on social media? In the absence of intent that is verbalized or written, there is danger that those who are already vulnerable to over-policing are more apt to be arrested under this ordinance. Not to mention that according to current local data, those who already face over-policing are also more apt to become ill with COVID-19. And what if something other than COVID-19 causes someone to sneeze or cough? As Board Bill 11 is currently written, someone suffering from something as benign as seasonal allergies could be targeted. As written, a person does not have to be capable of transmitting the coronavirus in order to be charged with a crime. And what if someone who is sneezed, spit, or coughed upon does not fall ill? Is it appropriate to fine or imprison a person if the only harm that occurs is the stress of the possibility of becoming ill? We know that people who show no symptoms can still transmit the virus, so it is impossible to know who is carrying the virus and who is not based on sneezing, coughing, or spitting alone. And might this be better suited for civil courts instead of criminal? If someone threatens to harm another person and manages to do so, there may be existing criminal statutes that already apply. If anxiety or trauma at the prospect of falling ill with COVID-19 is the harm in question, then civil-based action might be more appropriate. We have no way of knowing who has actually transmitted the virus to whom. If someone becomes ill with COVID-19, we may be able to anecdotally observe who they likely acquired the virus from. Yet we cannot scientifically prove who transmitted the virus to whom. We recognize that managing a pandemic is messy. Coughing, sneezing, and spitting is messy, and no one should have to tolerate being intentionally coughed, sneezed, or spat upon under any circumstances, whether we are in the midst of a pandemic or not. If passed, Board Bill 11 would draw energy and resources away from community solutions and toward the over-policing of vulnerable populations. At Empower Missouri, we look forward to continued engagement on this topic, and we'd be glad to discuss further with members of the Public Safety Committee.
Thank you, Molly. Does anyone on the committee have any questions for Molly? I'll just leave it open and just jump in.
I just want to thank Molly for your comment.
Thank you.
I'd like to, okay, go ahead.
I'm sorry. Alderman Howard, you were up there. I'm sorry.
I just would like to thank Molly. I think she summarized all the questions that the committee had and put them very concisely. These are things that we need to look at, and I appreciate you putting them all together and your testimony today. Thank you.
Thank you.
Anyone else on the committee?
Thank you, Molly, for coming out and participating and doing your civic duty. You did your homework, and I appreciate it. Thank you.
Thank you.
Thank you, Molly.
Okay, it seems like, so I would also like to say thanks, Molly. I do want to, in Alderman Bret's defense, I think what he's thinking of is like, and there's things on the book, and I'm a no vote on this, but here's the thing. I think what his intention is, if you go into Schnucks or someone, so you can't come in here, you don't have a mask on, and somebody gets mad and spits on them, to say, you know what, screw you, and spits on them. I think that's what he's looking at. And there are things on the books, and I do worry about this, like you said, the most vulnerable people, because people with mental illness are probably going to be the first ones to spit, hit, or do something where a normal thinking person, a more rational person, I should say, probably would not.
Oh, come on.
I'm sorry, what's that? Oh, she might be working with her computer. That or she was mad at me, I'm not sure. Carol's thing moves slow. Anyway, you got a nice, she's smiling, so anyway, if
Mr. Chairman.
Alderman Narayan.
Mr. Chairman.
Yes, sir, I'm sorry.
I want to follow back up with a couple questions with Alderman from the 24th.
Sure, go ahead.
You mentioned that you had a conversation with Judge Edwards about this, right?
Just on the phone calls that we've been, the regular phone calls that we've been having, where he indicated that there were people who were being charged under the terroristic threat. That's a state level charge. And I went and looked at it myself, and Judge Edwards indicated that it was being used as a bit of a catch-all right now. And, you know, I guess moving forward, it seems likely after this meeting that it will continue to be used as a catch-all.
And let me ask you this, because you're a lawyer, you have access to systems that we don't. Were you able to check the records to see, you know, how many people have been charged with this type of charge in the state?
I'm only going off of what the judge indicated in those calls, and if I recall correctly, he indicated 4 or 5 individuals had been charged with this.
So that's a state terrorist threat, not a federal.
Yes, it's a state threat for making a terroristic threat, and so there are certain elements that must be met in order to secure a conviction on something like that. And I think in instances like what we're talking about here, I think that's going to be a tough row to hoe for most prosecutors.
Well, I would hope that we're not charging people with that, and I will certainly speak to the Circuit Attorney's Office to find out more about that, because I think that's pretty extreme. So thank you for bringing it to our attention, and I have no further questions, Mr. Chairman.
Thank you. Does anyone else have any questions? Alderwoman Pam Boyd, did you have a question, or?
No, I have no more questions. Thank you.
Alderman Narayan, you could hold the bill, or you could take a vote, and we can vote it up.
I think at this point, I'd like to just hold the bill for the moment, if it pleases the chair.
Okay, yeah, we'll just kind of put it aside. I think at this point it would just die. So that's probably the smart thing. Molly, unless you have anything else to say, I would really thank you for coming and speaking. You're a good speaker.
Thank you. Thanks for having me. I appreciate it.
And at this point, I think we're done. If somebody wants to make a motion to adjourn.
I move to adjourn.
Second.
Second.
Madam Clerk? Do we call a roll on that, or we just kind of adjourn? No, we just adjourn. We're adjourned until we have this again. Thank you, everyone, for participating. I'm sorry it got a little choppy, but you guys are the best. We got the Public Safety Committee. We rock. Anyway, thank you all.
Hi, everybody.
Okay, God bless. Thanks, everyone.